Okay, so now we're going to talk about some risk factors that make patients more likely to become infected and make us more likely to become infected or transmit infection. Number one is inadequate hand hygiene. If you've ever been in a public bathroom and watched people come and go without washing their hands, it's very enlightening. So we start teaching hand hygiene with littles, and we want to continually reinforce that with patients all the way through adulthood, but also healthcare professionals sometimes skimp on hand hygiene because we're busy, we're in a hurry, the sink isn't convenient, the sanitizer dispenser is empty. So be diligent about your own hand hygiene as well. If a patient is immunocompromised, they're more likely to become infected. That makes sense because the immune system is there to fight off infection. Surgery increases the risk for infection, both because of the tissue injury that happens. We have an incision or some sort of tissue damage that's been done by the surgery, but also the stress of that surgery can suppress immune function. Any indwelling device, anything that did not grow in a body, if it gets put in a body, is going to be a site for infection. So think about Foley catheters, think about IVs, think about central lines, think about implanted devices like pacemakers and defibrillators. Anything that did not grow in the body, any foreign object is going to cause inflammation, and inflamed tissue is more at risk to grow bugs and become infected. Any break in the skin, because your skin is your primary defense against infection. So a break in the skin is an infection risk. Impaired oxygenation and impaired circulation, because those decrease tissue integrity. If I'm not getting enough oxygen in and I'm not circulating that oxygen effectively to my tissues, those tissues start to die, they get inflamed. That's a risk for infection. If I have an exposure to infection, I need good circulation and oxygenation to be able to heal that tissue. Chronic or other acute diseases, because some of the body's energy is used in fighting that disease, and also because chronic diseases suppress the immune system. Inadequate use of aseptic techniques. So people sometimes just get sloppy because they're in a hurry, or it's an emergency, or they have too much work to do. Poor hygiene. A patient with poor hygiene is more likely to be exposed to infection. Smoking. Smoking is a vasoconstrictor, and it causes long-term damage to vascular and to other tissues, and that tissue is more likely to get infected. Excessive alcohol suppresses the immune system. Excessive alcohol also tends to replace actual food, and nutritional deficiencies make people more susceptible to infection. On that note, poor nutrition, in particular, inadequate protein intake, but there are other nutrients that affect the immune system. Stress suppresses the immune system. When you went to nursing school or paramedic school, did you notice that you've never been sick ever and now you get a cold all the time? Because stress suppresses the immune system. Overcrowding makes it difficult to break the chain of transmission. People who are elderly or very young. So think about extremes of age. Very young babies and elderly people, their immune systems don't function quite as well. There are risky behaviors that increase the likelihood of exposure to infection. Think about risky drug use behaviors and risky sexual behaviors. Recent travel to a foreign country, especially an area with poor sanitation. We tend to have some immunity to the bugs that are ubiquitous around us, but if we go somewhere else, the people there may have immunity to those bugs, but we may not. So travel can increase infection risk. Okay, the next section is going to be longer because we're going to talk about specific infection precautions.